All right, in this video, we're talking blood buffers and pH. This can be a confusing topic. I'm going to try to simplify it as much as I possibly can. So the first thing, what is pH? pH is just a measure of the concentration of hydrogen ions in a solution. Right? So hydrogen ion, H+, and proton all mean the same thing because that's exactly what a hydrogen ion is. Right? A hydrogen atom is one electron and one proton. If it loses its electron, it's just a proton and it's got a positive charge, right? The negative log tells you two things. The negative flips the sign. That makes it a little bit confusing because if our concentration of H plus goes down, that actually means our pH went up, right? And that is the definition of something being basic or alkaline. Those are synonyms that mean the same thing. Okay? If you have an increase in H plus concentration, that means that you actually had a decrease in pH and you're becoming more acidic. All right, so don't get turned around. Protons down, pH up. Protons up, pH down. The purpose of doing this is to make sure that pH is always a positive number so we don't get negatives. All right, so given that definition, what is an acid? An acid is any molecule that donates or lets go of protons, because if you let go of protons, concentration goes up. You become acidic. A base is any molecule that takes away or soaks up protons. That makes your concentration go down, right? You become more basic. And so really, acids and bases, all they're doing are changing the concentration of protons in a solution. All right? So where this matters is you have to keep your pH very, very tightly controlled. A normal physiological pH is 7.4. You can tolerate 7.3 or 7.5, but anything out of that range and things start to not function optimally anymore. So we want to keep it very, very close to that level. All right. So we're going to see some chemical equations coming up on the next few slides. Just remember these terms. Reactants are just whatever molecules you started with. Products are whatever you end with. And those terms can change based on the direction of the reaction. So if we have a reaction where, like down here, A and B combine to form C and D, if we're going from left to right, A and B are the reactants, C and D are the products. If we go back the other direction, because many reactions are reversible, then C and D become the reactants, A and B are the products. Right? If you let a chemical reaction go and just sit without any changes, it eventually will reach equilibrium, which means the concentrations aren't changing anymore. But if you add things, so if I add more of either A or B, it'll push the reaction this way. If I add more of C or D, it would push the reaction this way, right? Same thing works for subtracting in the opposite direction. And so when we talk about equilibrium shifts, it just means if you change the concentrations of any of the items, the molecules in the reaction, it's going to shift the equilibrium and make it move, right? So as long as you remember, you push away from something you add, right, or you pull towards something you subtract, that'll go a long way in helping out. All right, so our goal in all of this is we want to keep our concentration of protons stable, right, that produces a pH of 7.4. In order to do that, we use molecules that are called buffers. And a buffer is just a mixture of an acid and a base that prevents pH changes. So if your blood starts becoming more basic, you need the buffer to act like an acid and bring you back down. If your blood is becoming more acidic, you need the buffer to act like a base and bring you back up. And so really the buffer just does the exact opposite of whatever the problem is. You're too acidic, buffer acts like a base. You're too basic, buffer acts like an acid. Right? And the equation that we're most concerned with here is absolutely critical for blood pH, so it's probably a good idea to just commit it to memory. Your organs and tissues are producing CO2, right? This tissue over here could be anything, a muscle, a heart, a brain, a kidney, skin, whatever. They all make CO2. It's a universal waste product. And so the fact that these cells are producing CO2 means that we have a high to low concentration in the blood, and some of that CO2 is going to float around in your plasma. That would be your PCO2, right? Dissolved carbon dioxide just in the liquid of your blood, but most of it combines with water, right? And this reaction is actually carried out by an enzyme called carbonic anhydrase. And the result of that reaction is carbonic anhydrase combines CO2 and water and converts it into H2CO3, right, which is a molecule called carbonic acid, right? Carbonic acid very, very quickly splits apart into two different ions. HCO3 minus is bicarb, which happens to act like a base. Obviously, carbonic acid is an acid, and a proton, right? The reason that carbonic acid is an acid is because it breaks apart and releases protons. Because remember, the definition of acidic is just a high proton concentration. Okay, so this is why we say that CO2 acts like an acid. The more CO2 your organs make, right, muscles can make the most, more CO2 means more carbonic acid. More carbonic acid means more protons. Okay, so in all of this, your hemoglobin is doing a few different things. First, it's not shown here, but hemoglobin is obviously releasing oxygen, right, floating out into the tissues. And it's also picking up some CO2, right? So some CO2 can bind directly to hemoglobin. It's called carbaminohemoglobin. And the hemoglobin can also pick up some of these protons, right? And so hemoglobin, think of it as being able to carry three things: oxygen, CO2, and protons. In these tissues, it's letting go of oxygen, and it's picking up CO2 and protons. The fact that hemoglobin can pick up protons means that hemoglobin is technically a buffer as well, right? It'll pick up these protons in your systemic tissues where levels are high and then drop them off at the lungs eventually when levels are low. Okay, so when we get to the lungs, right, in your alveoli, pulmonary capillaries, obviously the oxygen is leaving because we have a high to low gradient, meaning leaving the air and entering the blood. CO2, right, is diffusing out of the blood and entering the air. That means that when you get to the lungs, your hemoglobin is going to release the carbon dioxide. It's going to pick up oxygen instead, and it's also going to release those protons, right? And so if this is now the lungs, we're going to reverse the direction of these arrows. We're going to move back this way. Bicarb and the proton are going to combine to form carbonic acid. Carbonic acid is going to split back into CO2 and water, and that CO2, right, is going to go out into the air of the alveoli, right, because now we have a high to low gradient. So the exact same thing's happening in the lungs, you just flip the direction. Take your protons back, turn them back into carbonic acid, back into CO2 and water so the CO2 can be breathed out, right? This means that since proton levels are going down, your lungs tend to lean towards being a little bit on the basic side because you're removing your protons to convert them back into CO2, whereas in your systemic tissues, they lean a bit more acidic because we're making CO2, making carbonic acid, making more protons. Okay, so in all of this, think about what's going to happen if we change our breathing up, right? If you breathe too fast, which would be hyperventilation, you're breathing out your CO2. CO2 levels go down. If CO2 levels decrease, remember, you pull towards something that goes down, so the equilibrium shift would go this way. That means you're removing bicarbonate protons to make carbonic acid turning back into CO2 so you can breathe it out. This is going to make you become alkaline or basic. Right? So hyperventilation causes respiratory alkalosis because your CO2 levels go down. Right? Remember, CO2 acts like an acid, so if you have less CO2, less acidic is basically the same thing as more basic. On the flip side, if you breathe too slowly, hypoventilate, CO2 builds up, right? If CO2 levels increase, that basically means that the equilibrium shift is now going to go this direction. More carbonic acid, more protons. The increased protons, again, means your pH goes down. You become acidic. That is respiratory acidosis. more CO2, more protons. If your blood buffers can't buffer, right, this won't happen instantly. Your buffers kick in. But once the buffers are saturated, you really do become acidic or basic. All right. Hope this was helpful. Follow along on the playlist. We've got one more on respiratory diseases before we move on to another section.